Imagine for a second that everything you know about the origins of modern medicine is wrong. We are taught that modern surgery began in the gleaming operating theaters of 19th century Europe, right? That it was born from the genius of the Renaissance. But what if I told you that the very foundations of the surgical procedures you take for granted today were laid over 1,000 years ago in a place you might not expect? What if the father of modern surgery wasn't a European at all, but a Muslim physician from a city of light in what is now Spain? We have been looking at history through a very narrow lens, and it is time to widen our view. We are about to uncover a story of innovation so profound that it literally shaped the medicine you trust with your life. A story that has been hiding in plain sight, waiting to be told. To understand how deep this goes, we have to travel back to the 10th century, to a time when Europe was lost in what historians call the Dark Ages. While the continent was struggling through centuries of intellectual decline, a beacon of knowledge and civilization was burning bright in the Islamic world. Right in the heart of this golden age, in the city of Cordova in Andalusia, a brilliant mind was about to change the course of human history. His name was Abu al-Qasim Khalaf ibn al-Abbas al-Zahrawi, or as he is known in the West, Albucasis. And he wasn't just any doctor. He was a pioneer who wrote the medical textbook that would dominate European universities for over 5 centuries. He created over 200 new surgical instruments. He performed operations that wouldn't be seen again in Europe for hundreds of years. So, what made this man so far ahead of his time, and why has his story been so easily forgotten? The answer to that question holds a critical secret about our past. Now, you have to understand the world Al-Zahrawi lived in. In Europe at that time, surgery was considered a lowly craft, something fit for barbers and butchers, not for respectable physicians. In fact, the Council of Tours declared that surgery was to be abandoned by all decent doctors. It was messy and terrifying and often fatal. But in the Islamic civilization, things were completely different. Surgery was elevated to a science. It was taught in universities alongside medicine. Hospitals were not just places to die, they were masterpieces of architecture with separate wards for men and women, for different diseases, with pharmacies that dispensed free drugs to the poor. They even had chapels for Christian patients and mosques for Muslims. This was the world in which Al-Zahrawi practiced his art. He was the personal physician to the Caliph of Andalusia, a man who oversaw a society where knowledge was the highest currency. This was not a fringe practitioner working in the shadows. He was a master of his craft in one of the most advanced societies on earth. He spent his life documenting everything he knew in a massive 30-volume encyclopedia called Al-Tasrif, which is the culmination of 50 years of studying, teaching, and practicing medicine. In a world where misinformation spread as easily as fire, he offered something completely revolutionary. He believed that before you even pick up a scalpel, you must understand what lies beneath the skin. Before practicing, he wrote, one should be familiar with the science of anatomy and the functions of organs. He stressed the absolute necessity of knowing the bones, nerves, and muscles. This might sound obvious to you today, but in a time when superstition reigned, this was a radical, life-saving principle. Al-Zahrawi was a meticulous record keeper. He insisted that only by repeated visits to the patient's bedside could a physician truly learn. One of the most astonishing things he described was the disease hemophilia, a hereditary blood clotting disorder, over 1,000 years ago. He noticed that some of his patients, often boys, would bleed to death from even a minor wound. He wrote that the males of certain families would die from their wounds, while the females would survive. This is one of the first known descriptions of this condition, a testament to his incredible powers of observation. He not only observed the disease, but he also pioneered the techniques to fight it. He was the first to use cotton to control bleeding and padding to splint fractures. He also used wax, alcohol, and even ligatures to tie off blood vessels long before a French surgeon named Ambroise Paré was given credit for it centuries later. Think about that for a second. The simple cotton ball used in your last surgery, the method a surgeon uses to stop bleeding, it all traces back to this man. His innovations were not just about control, but about precision. He invented instruments that were so effective, so perfectly designed, that they were used for centuries and are still recognizable to modern surgeons. He designed forceps to extract a stone from the bladder, a procedure that was previously done with a clumsy, spoon-like tool. This new instrument had a better grasp and drastically reduced the risk of the operation. He invented a metal probe to locate the stone before surgery. He even created a special drill to pierce impacted stones in the urethra. He applied this genius to every part of the body, from the brain to the eye. He was a pioneer in neurosurgery, performing trephination procedures to relieve pressure on the brain from trauma, and he innovated techniques for spinal traction. His methods for treating spinal injuries were so sound that they are still practiced in modern neurosurgery to this day. Let's talk about the operating room. Before modern anesthesia, surgery was a race against time and a test of endurance against pain. Al-Zahrawi and other Islamic physicians were among the first to use anesthesia. They used sponges soaked in a mixture of opium, mandrake, and hyoscyamus, which were inhaled by the patient to induce a state of unconsciousness during the procedure. This was a level of sophistication that was lost on the European medical scene for many years after. And think about this. He was a master of what we now call plastic surgery. He performed reduction mammoplasty, which is a modern procedure to reduce the size of large breasts, and described a technique for treating gynecomastia, which is when males develop breast tissue. He used catgut, which is an absorbable suture made from sheep gut for internal stitching. He observed that the strings of a musical instrument made from sheep's gut would dissolve in a monkey's stomach, leading him to use them as sutures that would be absorbed by the body. This is the same principle used in many absorbable sutures today. The question we have to ask ourselves is, if the foundation of modern surgery was built by this man, how did he get erased from the story? How did a figure of such monumental importance become a footnote in history? The answer is complex, tied to the ebb and flow of empires, the translation of knowledge, and a tendency to view history through a single lens. But the truth is, his influence was undeniable. His book, Al-Tasrif, didn't just sit on a shelf. It was translated into Latin in the Middle Ages and became the standard surgical textbook across Europe for over 500 years. European surgeons like Guy de Chauliac, who is considered the father of modern French surgery, relied heavily on Al-Zahrawi's work. They didn't just read it, they copied it, they learned from it, and they built their careers on it. When you think about the Renaissance, which is often celebrated as the rebirth of learning, it was essentially Europe waking up to the knowledge that had been preserved and advanced by the Islamic world. In a way, the modern era of surgery only began when Europeans finally started translating and reading Al-Zahrawi's work. He truly was the chief of all surgeons. His story is not just a history lesson, it is a direct line to our present. It challenges us to re-evaluate the stories we tell about ourselves and our past. It shows us that progress is not a straight line from the West, but a shared human endeavor. And it makes you wonder, What other forgotten geniuses are out there, waiting to be rediscovered, whose innovations will continue to shape our future? Think about that the next time you are in a hospital,